Hello, my name is Madeleine Williams and this is a PSY4407 presentation looking at domestic violence against women, and the particular focus of this presentation will be on male perpetrators of family violence. Domestic violence against women. So I've cited an APA reference, the American Psychiatric Association, in defining family violence as a pattern of abusive behaviours, and that can include physical, sexual and psychological maltreatment by one person to the other in an intimate relationship. So whilst it's largely accepted and acknowledged that family violence takes many forms, for example in same-sex relationships or children being the perpetrators of family violence, this presentation will focus on the male in the relationship, and it's also going to look over etiology, so the individual factors that perpetrate male offending, why it's important that the courts address this, because it is from a forensic viewpoint that this presentation will be done, what evidence-based practice is out there, so what can we do to try and reduce, minimise and stop potentially family violence from occurring, and that will look at men's behaviour change programs, and then a little bit on specific services, so which services will work with them and what do they actually do. So a systematic review of 25 longitudinal studies by Costa et al. Found that there was 4 main domains that were external factors and longitudinal predictors of somebody growing up and then offending as a perpetrator of male family violence against their female intimate partner. So being raised by a single parent, witnessing parental violence, poor relationships with parents, and if you were parentified, meaning that if you were the one that had to look after your parents rather than your parents looked after you, then there was a greater likelihood then that you would be an adult male offender. There's a lot of conjecture around the child and adolescent abuse experience. They had a look at 5 journal articles that investigated this, and there was a statistical finding in regards to if the young person was abused as a child, then they were more likely to perpetrate physical violence and verbal aggression, P.05 in both in romantic relationships as adults, than their, I guess, age and demographic equivalent that didn't experience abuse as adolescents. So it's interesting in the behavioural domain, there was inconsistent findings in the literature, and my assessment of this is because behavioural as a individual external factor also has some implicit or intrinsic overlap, i.e. behaviour can be determined on things like neurological factors. The longitudinal study by Costa et al. Also identified socio-demographic status as a predictor of male violence. So looking at the research strengths and weaknesses, it's a systematic review, so quite a strong level of research in the academic field. It's peer-reviewed and it looks at 25 articles. The weaknesses I identified were that in the discussion section I identified that whilst the research articles separated gender for findings, there was often more women reporting. This is consistent with one of my other, my student colleagues at one of their presentation points as well, reporting being both perpetrators and victims of domestic violence, so perhaps indicating that there was gender disparity in the participant pool, or it possibly means women just tend to report more. So the other weakness was that adult perpetration and victimisation were highly correlated across the 25 articles, so this leaves an element of confusion as if the longitudinal factors were predictors of perpetration or victimisation or both. So I thought I'd just have a quick look at the impact on women when male offend against them. The overarching topic being domestic violence against women, I wanted to include just a little bit on this. So this is from a forensic point of view, the DHS child protection standards outline, have a whole section on what happens to women when men offend against them. And the ABA stats there, 20% of women have experienced family violence. So what they found was that mental health, they suffered mental health consequences, cognitive consequences and reproductive health consequences, so including your depression and anxiety symptoms, PTSD, insomnia and phobias, all anxiety based. Cognitively, poor concentration, intrusive thoughts and poor memory, and reproductive health, really important. So it can have an impact on ovulation cycles. Women become really vulnerable when they're pregnant in family violence situations, and of course if there's a physical assault, that can have an impact on the growing fetus as well. So what can we do to sort of look at preventing or minimising this really serious issue? Generally, men that perpetrate domestic violence in a forensic setting are mandated to undergo treatment or assessment. Reports about engagement and attendance with the forensic psychologist are then given back to the court to help them determine risk, bail, recidivism, and sentencing. Treatment can include one-on-one counselling or group therapy, but at the moment the best practice is considered to be men's behaviour change programs. So the below diagram just has a look at the fact that it's peer driven, the content is driven by the perpetrators, the psychologist or clinician facilitates it and looks at process rather than content, and there's a large amount of accountability held, so the offenders will challenge each other within that setting, and that's part of the reason that it's so effective. In Australia, Men's Line Australia, Family Life, LifeWorks and Anglicare all offer this. There are probably more, but they're just a few of the big ones. On the Men's Line Australia website, they've got a 2-minute video called Call Me Dad, and it's anecdotal. It's a man that's saying that he went through it and his experience. The clinician says, can you tell me about the last time that you blew up? And he talks about, his right leg twitching, he was feeling confused and flustered, he wanted to die and he didn't feel heard. So it gives you a bit of a snapshot into what actually goes on during these men's behaviour treatment programs. Really effective. There is some new research that's come out. Mayer examined the role of fatherhood as a motivator to reduce family violence. So some of the literature is indicating that male offenders, their individual or intrinsic factors include that they have low assertiveness and low self-esteem, and they also have really low social skills and empathy. So they generally have victim-blaming attitudes and they don't show much empathy towards their partners. So one thing that Mayer's started to look at is the fact that even though they can't empathise with their female partner that they've abused, they can empathise with their children, and this might be a way to begin to motivate them to look at family violence as affecting the whole household and the females to reduce it generally. There's also been an increase in psychological profiling, so I know that's been around for a really long time, but what they're starting to include and the way they're starting to do it is changing and evolving. So what they're looking at the moment is impulsivity, social skills, attitudes towards women, and to create a typology profile, so a personality profile spectrum. And what they've done is range it from mild all the way to generally violent or antisocial. And this profile can then be used to give back to courts as a way of indicating the risk level and then maybe having implications for sentencing and those sorts of things. So again, just some information about the research that exists that demonstrates that men that perpetrate family violence really do have lower self-esteem and lower assertiveness levels. What's great about those two research pieces is that it's new, it's innovative, but of course there are some limitations and weaknesses, and both of those articles have small sample sizes. I suppose also there's no other research that supports or replicates those findings at this stage, so there's quite low reliability. In summary, domestic violence against women by male perpetrators can affect up to 1 in 5, potentially more, based on stats. The cost to women, family and the community is significant. Men that offend against women are charged and then placed in a court system for punishment and management, and often mandated to treatment programs like men's behaviour change, where patterns of behaviours are then challenged in a group setting. Forensic psychologists can assist the courts in things like intervention order hearings and family law court matters, and we're starting to see some new emerging ideas about how we can begin to treat offenders to try and reduce male offending against women in the family home. Thank you very much.